a parent comes in worried about a photo with a white reflex. And I know in my practice as a pediatric ophthalmologist, it's such a common question, and it's not necessarily always straightforward to reassure them or decide when it needs urgent workup. So how do you approach these conversations in clinic?
Yeah. Such a great question and such an important question. So I'm always thrilled when parents recognize the leukocoria or recognize the glow in a photo and bring their child in to be evaluated. Oftentimes they see my pediatric ophthalmology colleagues first, and they get to me maybe if the parent is extra persistent. And I actually tell them that I have a really striking photo of my completely normal daughter who's looking in a certain direction and has really striking leukocoria or the white reflex in that photo. And that photos in and of themselves are about raising awareness, letting parents know when to bring their children in. But once they're in the ophthalmology office, we have so many better tools to identify what's going on in the eye, and that we don't have to rely any longer on the photos that they have on their iPhone.
Because I bet there's probably some part of it, even when you do your full eye exam, that they say, but this picture still has the white reflex. And you've started this campaign. I forget what is it?
Yeah, well, I didn't start it, but I work with the team, Know the Glow.
Yes,
and
I love
so,
that.
yeah, it's my mentor coined the term, and it's so great. So I think it's so important that every parent can know the glow, meaning that they understand that if there's leukocoria in a photo, not necessarily just once, but repeated leukocoria, that child really should come to evaluation. And so, again, I'm thrilled when parents know the glow and they bring their kiddos in. I often get emails or parents will reach out to me and say, I saw the glow, here's the picture. I went to an eye doctor. The eye doctor did a full exam. They say my child is completely normal, but I don't believe it. I'm sure they have retinoblastoma.
Yes.
You know, can I come see you? And really in those cases, I reassure them that if they've had a fully normal eye exam by someone who has dilated their eye and looked all around, they can rest assured. In my practice, of course, I have access to a B-scan ultrasound, which takes, an image in the back of the eye. So for anyone who comes to me, I'm always going to ultrasound them. I often will take pictures of one or both eyes and say, look, they look the same. Here are the ultrasounds. They're very normal. But trying to build that trust sometimes can take some time and take some additional imaging.
Well, and I think you and I are both moms. And I know personally, especially with our medical experience, like if something happens to my child, my mind already goes to the worst case scenario typically.
That's right.
And so I understand where parents are coming from. But is it enough? Just they might feel like, well, we saw the pediatric ophthalmologist or we saw an optometrist.
Right.
They dilated the eyes, but we're not sure
Yeah.
if it's enough. How do you counsel them in that way?
Well, to be honest, it is hard because almost all of my patients who all have retinoblastoma were told by another doctor that their eye was fine.
Really?
Almost all of them.
They're not referred from the...
Right. And so it is a really difficult situation,
Yes.
and I'm glad parents trust their gut, and I'm glad they push.
Yes.
When they're in the office of an ophthalmologist and the ophthalmologist has seen them, has put the drops in to dilate them, again, sometimes put the probe on the eye to do the ultrasound, I really feel confident about reassuring them that they had a good workup. They were checked for glasses, the glasses prescription was the same, all of these good things. If somebody was not seen by an eye care professional, then I really recommend that they are because, in a pediatric office, it can be very difficult to see leukocoria well. Very, very difficult. They don't have any of the tools that we have for that. And if parents are seeing it, they'll say, oh, every time I bathe my daughter, I notice the leukocoria. Well, they're probably bathing their daughter in a low light condition. The pupil is dilating and they're noticing something. And so I think it's completely fine to do an ultrasound, to send patients to eye care providers, and to really get a full workup in those situations. In fact, if I could say anything to my colleagues who don't do ophthalmology, it's if a parent has complained once or especially twice about leukocoria, just refer them.
Right.
Just refer them.
I think sometimes people worry, oh, well, I don't want to send a patient unnecessarily or give them extra anxiety, but they're already anxious.
They're already anxious.
Yeah. I mean, there are, of course, I see in my office a lot of different reasons to cause leukocoria.
Yep.
You can get it from misalignment of your eyes or uncorrected refractive error
That's
or
correct.
astigmatism. But when they're in your office, you're going through all the other things. Hopefully, if they've gotten from me, and I say, well, I don't see the astigmatism, I don't see the strabismus, but I'm
Right.
also not doing an ultrasound in
Right.
the office.
Right.
I'm usually not doing a very, extensive peripheral
Yeah.
exam. I'm not.
That's right. It's a
using
different
scleral
specialty,
depressor.
really.
It's a totally different area, but I will always refer if I feel like I'm not getting a good view. And there's sometimes patients that we just don't get a good examination, and for the most part, then it's
That's
just
right.
better to send.
That's right. And when the patients come to me, I need to do a really detailed
Yes.
evaluation. If a child has any mass in the back of the retina, even if it's not retinoblastoma, you still need a really detailed evaluation. So not only do I have tons of equipment, I put my kiddos to sleep. So my patients go to sleep, they have safe anesthesia done by a pediatric anesthesiologist, so then I can do my job without a kid screaming, a parent being anxious because their baby is screaming, without me being kicked by a kid,
Yes. Yeah.
Like they get to go to sleep, they are comfortable and safe, and then I do everything I need to do to evaluate what's going on with the eye.
And when I trained in New York, almost 25 years ago, Dave Abramson was doing the same thing.
Right.
And I think he was getting a lot of flack for it initially because there was a lot of anesthesia for these exams. But I could not imagine getting as good of an examination in my office
you
when they're
can't.
awake and they're sitting on the parent's lap, and sometimes the parent doesn't want to hold them. I'm getting a look just of the posterior pole.
Yep, that's
essentially.
exactly right.
Maybe some glimpses if they're moving all around of something else, but otherwise just of the center part of the retina, and retinoblastoma could be in the periphery.
That's exactly right.
And we can miss it. So I didn't realize that you also put them to sleep, and I think that just seems to be the most effective way.
Yeah, I think for most of us, it's standard now. Thankfully, anesthesia in kids, especially when done by somebody who is used to putting children to sleep, is very safe. It's very controlled. It actually makes the exam a lot faster because we're not fighting. In clinic, I probably see 30% of the eye, right? And I'm seeing that, I'm moving, the kid's moving, everyone's moving. When they're asleep, I can see 100% of the eye. I can actually even do, special anterior UBM imaging, so I can evaluate the area behind the iris and make sure the ciliary body is okay. All of this is really necessary. And so, I tell parents, if I think that there's retinoblastoma there, this has to be done, because this is a cancer that, if not taken care of and treated, is not only blinding and a risk to the eye, but is a risk to the life. So yes, there's always some risk with things, including with anesthesia, but if we think it's retinoblastoma, that has risk too, and it needs to be evaluated.
For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong, or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.